And welcome to the Dr. Bob Show. Prostate cancer is a huge problem in the United States, one of the leading causes of cancer death for men in the United States. The diagnosis is getting easier and easier with special blood work specific for prostate cancer as well as regular examinations. Once the diagnosis is established, then we have to decide what form of treatment is available. We'll be spending most of this show talking about a new exciting form of treatment, proton beam therapy. My guest is Dr. Marcio Fagundes. Dr. Fagundes is the medical director for the Provision Center for Proton Therapy, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about hardening of the arteries. Can it be prevented? And shoulder pain. What kind of treatment can keep us from having surgery? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Marcio Fagundes, Medical Director of Provision Center for Proton Therapy. Marcio, welcome to the Dr. Bob Show.
Thank you for having me.
How long have you been involved in radiation treatment?
More than 20 years. I finished my training around 1993.
Where were you training then?
I was training at the University of Miami in residency.
And you went?
Then I went to Harvard to do training in proton therapy around 1994. So that's around 20 years ago.
One of the leading places in the world.
Yeah.
Tell me about proton therapy and prostate cancer. Who is a good qualified person for therapy with prostate cancer?
Well, prostate cancer, fortunately, most of the cancers we diagnose are still localized. So we can treat localized cancers with the goal of curing the patient. So patients that have early stage cancer can be treated with a very high probability of cure. Even patients that have cancer that may have spread to the lymph nodes can still be cured.
So if the cancer is spread to the lymph nodes, does the proton therapy include the lymph node, or we just get the big cancer that's inside the prostate gland?
Yeah, so when we're talking about a slightly more advanced disease like that has reached lymph nodes, we do treat the prostate, seminal vesicles, and lymph nodes.
So let's go back to an isolated tumor in the prostate gland. What is proton beam therapy, and why is it an advantage over other forms of treatment?
Well, proton therapy, just to understand, is the most advanced form of cancer therapy utilizing radiation. Now, we don't use X-rays, which is conventional radiation. We use particles. Particles stop in the body at a very controlled depth. So we can send the particles as deep as needed, and when they reach the cancer, the particles stop and deposit that radiation energy right where you need it, avoiding any radiation in the surrounding tissues.
So that's the key issue. You can guide it, stop it, rather than what happens with routine radiation therapy?
Right. So some patients will say to me, this is like, protons is like shooting a rifle, with a sharp aim, where conventional radiation is like a shotgun, where you spread the dose quite a bit more, exposing normal organs around the target area. And that's true. But there's also the concept that you need to understand that protons, we stop it. So you go as deep as you need and not further. So it does spare a lot of the surrounding tissues around the prostate.
So what are the tissues that surround the prostate that we want to be careful not to get radiation damage?
Well, basically, when we treat the prostate gland, we treat a slight margin around it that will include a little bit of the bladder, a little bit of the rectum, and that's what we need to do. That's it. Now, if you do conventional radiation, you're going to be including more of the bladder, more of the rectum than needs to be done. So proton therapy is more selective.
So let's give an example of both regular radiation therapy, X-ray therapy, and proton beam therapy, about It stops. What is the other one doesn't stop? Well, what happens if it doesn't stop?
Well, basically, that's the concept of the beam coming in, entrance dose, reaching the target and exiting the other side of the body. So there's exit dose. So the bottom line is conventional radiation will deposit dose beyond what you really need outside of your targeted area. So we were looking at an image, right, where the beam comes with protons and it stops right on the prostate gland. And in conventional radiation, you have these beams of radiation that come from different directions, ultimately traversing the body and treating more than is needed.
So what we've got is an isolated proton-active particles that deposit radiation and stop it right there rather than continuing to the rest of the prostate gland and surrounding areas.
Right. Now there's something very important is that proton therapy has evolved from what we used to do 20 years ago, now using something called pencil beam scanning. So that allows us to intensify the number of spots that we want in one specific area of the prostate versus another. And we can de-intensify or decrease the amount of dose that reaches the rectum or the bladder. So proton therapy today, what we use at ProVision today, is superior to what was available 5 years ago or 10 years ago.
Wow, so it's getting better and better.
Right.
And the thing that's making the proton pencil beam therapy better again is what?
Is the ability to send the proton spot by spot where you put more dose in one area, less dose on another. That gives you even more selectivity or the ability to better select where you need the dose and what you need to avoid.
So you don't need surgery?
Well, you know, when we talk to patients that come in with diagnosis for with prostate cancer, we talk to them about options. Yes, you can do proton therapy without doing surgery, absolutely. Surgery is another option. You can choose to do surgery. Conventional radiation is available, but we're talking about the disadvantages and advantages and the advantages of protons.
What are some of the big side effects of proton beam therapy? If you send the particles pencil beam, you stop them, you deposit the radiation, are there side effects that are significant?
You know, a little sliver of the neighboring organs, basically the bladder and the rectum, receive some dose, but a smaller dose than conventional radiation. So, you know, you could tell the patient, well, you know, it's expected that you may feel a little bit of a need to urinate more frequently during treatment, during the several weeks of treatment. But that tends to go away about a month later. It's very rare that a patient would have any intestinal side effects from treatment.
Now, intestinal, are you talking about the colon? Do you get
loose stools or diarrhea? Proctitis, very, very rare. Yes.
So you isolate it, you don't get the side effects. You have the. How long does the therapy take?
Okay, the treatment actually, laying down for treatment only takes about a minute or so to deliver the dose from each side. There are two fields, one from the left, one from the right, that are treated for prostate cancer. Now, total time laying down, doing imaging for precision aiming, setting up the patient, everything, when it's all said and done, it's about 15 minutes, maybe 18 minutes per day, Monday through Friday, 5 days a week, and this may go on for 7.5 weeks.
So it can go on for 7 weeks, so you have to make sure that you're available for that treatment for that period of time. Do the symptoms change from week 1 to week 2 to week 3 to week 4? Does the patient know anything's going on?
It takes a few weeks, you know, for the patient to even notice anything. And this irritation to urinate a little bit more frequent is very minor. And it may, you know, show up about the 4th week into treatment. Now, it's important to mention that patients don't feel anything as they're having a treatment. They're basically laying down, they don't feel anything. They get up and they can go about their business, exercise, work, continue normal diet during treatment, and there are no immediate side effects.
Now, if somebody's having the proton beam therapy, how do you identify exactly where the beam goes? It seems like that would be critical.
Yes, and for that we use image guidance. Okay, that's a very important question. Image guided treatment delivery. So we place these gold markers inside the prostate, these tiny little markers. We only do this once. It's a very thin needle. We numb up the skin and place them inside the prostate. We call them fiducial markers. Every day before treatment, we do a very quick x-ray, very low dose x-ray to verify that those markers are precisely where they should be. And then we deliver the treatment. So it's really guided with image guidance, if you would, to assure accuracy.
So I anticipate that you have to spend a great deal of time or a few minutes of time making sure the patient is positioned
Yes.
exactly, doesn't move. Is it hard not moving while you're having the treatment?
If the patient is comfortable, that's one of the main things, is to have the patient laying down in a comfortable position. They're able to hold still and just, you know, sometimes we have their favorite music playing and keep them relaxed. It's only about 15 minutes. Yeah.
And when the patient leaves, are they able to go about their normal activities each day?
Totally normal.
And that's what we're going to be talking about later on. Let's walk through a patient. Let's walk through their treatment. Let's see what kind of problems they do or they don't have and how successful the treatment is. Very, very exciting. We're talking with Dr. Marcio Fagundes, the medical director of the Provision Center for Proton Therapy located in Knoxville. Now, it's in Knoxville. How many centers are there right now?
There are 17 centers in the country right now. We were the 13th center to open. And it's interesting that proton therapy is growing so much that in 2 years, there'll be nearly 30 centers in the country.
So why is it growing? And my answer would be because it's such a good form of treatment for patients.
Yes. It's a more advanced form of doing radiation. It's more selective. So all the major NCI designated cancer centers in the country, like Mayo Clinic has 2 centers, one already open, one is opening next year. MD Anderson has a center. Sloan Kettering is partnered to develop a center. Johns Hopkins will develop a center. Harvard has their own. So
these are big names, and now
all these are big names.
And we've got one of the 13 initial ones in Knoxville, Tennessee.
Yep.
Thank you for coming and being our medical director here, because I just think that gives worlds of accreditation for your experience that you've had. Now let's get back to the treatment. Somebody has the diagnosis of prostate cancer. It hasn't spread to the bones or anywhere else, and they come into your office and they're nervous, they've got cancer, they want to know what the treatment is. What options do you give them?
Well, so a patient that has localized cancer still confined to the prostate, right? There are 4 proven modalities that one could look at currently that have long track record, that have been used for many, many years. And certainly surgery would be one of them. Another would be conventional radiation, we talked about that. Another would be a seed implant or brachytherapy, which I did for many, many years. And then proton radiotherapy. And these are the options that one should really be looking at.
So why are you such an advocate of the proton beam therapy? This is the issue that I want to get to, because it's really so great and I'm so excited about it. Why in your mind is this so much better?
Well, I mean, proton therapy, number one, is non-invasive, right? It doesn't require anesthesia. If you look at the results from the older study from Massachusetts General Hospital in Loma Linda, and the newer study that was published out of the University of Florida Proton Center, you'll see that the probability of a patient being disease-free, proven by PSA, 5 years after treatment, is in the order of 99%. That is patients with localized disease. If we look at longer term, say 10, 15 years later, that may drop a bit down to about 95, 94. But if you compare to the other treatments available in the country, such as surgery and others, it's going to be in the same level of success. So the bottom line is that it's a treatment that is as successful but non-invasive.
Now let me talk to you about some side effects. The conventional treatment, if we've got radiation implants, some seeds, radiation therapy, people have problems with proctitis. What would that be, proctitis?
Proctitis would be inflammation of the rectal wall, right? Right where the rectum that abuts the prostate, right there. So we try to minimize the amount of radiation that reaches that area of the rectum to minimize the risks of such a problem happening.
Pretty good at that?
Yeah, we're pretty good at that.
And so we've got less irritation of the colon. How about urinary symptoms? How about incontinence?
Incontinence, we just don't see urinary incontinence with proton therapy. We just don't. You know, a patient would have to be very advanced age, maybe have underlying problems like diabetes, hypertension, vascular disease, maybe already have some incontinence already as his baseline problem, to maybe say, well, maybe this increased a little bit after treatment. But in a patient that is otherwise normal functioning, controlling his urine, we don't see incontinence. We just don't.
For the viewer's education, we've got the kidneys. They send the urine to the bladder, and then through the male urethra, which carries the urine from the bladder to the outside. That's where the prostate gland is, around that.
Right.
So when you hone in with proton beam therapy, you don't mess around with the urethral tube.
You just irritate the urethra temporarily, just for a few weeks. The urethra is very tolerant. You can actually deliver very high doses of radiation dose to the urethra without causing any permanent issues with it. So there's temporary inflammation, which we treat with very simple medicines, such as an anti-inflammatory, maybe a Flomax, and that's about it.
So right now, the side effects, how about no proctitis is taken care of, the incontinence we don't see. How about erectile dysfunction?
Erectile dysfunction, you know, we expect 1 out of 5 patients, 1 out of 5, 20% risk, that the patients would have some decrease in erections after treatment. That is realistic. You know, expectation.
Do medications help that?
They can.
So there can be ways to circumvent that.
Yes.
Is there less problems with erectile dysfunction problems with proton beam versus surgery versus radiation?
Versus surgery, if you look at surgical data, it's probably more like a 50%, you know, 50% risk. Yeah, proton therapy is a lower risk. Yes.
And there's no surgery, so you don't have blood loss.
Right.
So really the things that are wrong with traditional forms of surgery seem to be circumvented with the proton beam therapy. How accurate are you at honing in and putting the proton beam and stopping it right where you want it?
That's a great question. You know, protons, the accuracy, we measure this on quality assurance measures. We have devices to measure, yeah. And it is about a 2 millimeter precision where the protons stop. So that is built into the plan. So when we define this is our target, this is an expansion around it. So if we cover the expansion of a few millimeters beyond it, we know we're covering the target. So that's how we assure that we're accurately treating all we need to treat.
When you have patients that are looking at making a decision on type of treatment, we were talking about a physician who really asked well over 100 people what their problems were and what their side effects were, and they came to proton therapy. Are there any disadvantages to proton therapy?
It's really the only disadvantage you could say is that you have to come in every day for treatment, Monday through Friday, you know, for several weeks, but you're only in the building for less than an hour, 15 minutes laying down, and if you can, you know, accommodate that in your schedule, but be perfectly functional throughout the rest of the time with no recovery, no anesthesia.
It's a no-brainer.
Right, exactly.
Now, as we get older, we don't get very comfortable as we're laying down sometimes on a hard old table. Is this a hard table? What do you do to make the patient comfortable?
There are ways to make devices that will accommodate the patient's back and buttock to make it more comfortable. Yeah.
Good. It just seems like it's a wonderful thing. Dr. Fagundes, thank you for coming to the Dr. Bob Show. Proton beam therapy sends the proton radiation where it's directed right on top of the cancer, destroys the cancer, the follow-up, no recurrence later on. What a great thing. What a great advancement for people in the United States. Thank you for coming to Knoxville.
Thank you for having me.
Thank you for providing this service to our people. You've been a great teacher, and I thank you. Now you'll want to stay tuned. What a great show. What a great thing to have, proton beam therapy. Know that if you've got prostate cancer, it may be something that is exact for you. And now you'll want to stay tuned. We're going to be talking about hardening of the arteries and shoulder pain. Can we keep from having surgery? A lot of information. I want to thank Dr. Marcio Fagundes' wonderful discussion on proton beam therapy for prostate cancer. It's also available for other tumors that I didn't have time to show on the show. But now for questions from you, the viewer, that I think will be important to your health. Question number 1, Dr. Bob, hardening of the arteries, what does that really mean and can I prevent it? Well, the arteries are very rubbery, very soft, very elastic. That's when the heart beats, it throws blood out to the arteries, where the blood will nourish any type of tissue that it sends blood to. So the fingers, to the toes, to the heart, to the liver, to the belly, all of those, the arteries carry blood supply. Now, if the arteries become hard for some reason, then the blood is more difficult to get through that arteries. That's called hardening of the arteries. That's where cholesterol is deposited into the walls of the artery, and the cholesterol plaques make the artery very, very hard and makes it where the blood can't nourish different parts of the body. So what are some of the problems that we can get? Number one, we can get strokes that occur because of hardening of the arteries. We can get high blood pressure because of hardening of the arteries. We can get problems with vision because of hardening of the arteries. We can have heart attacks because of hardening of the arteries. There's called an abdominal aortic aneurysm, where there's a ballooning of the blood vessels in the abdomen. If those rupture, then we bleed to death in a period of 2 to 3 minutes. Or we can get lack of nourishment, hardening of the arteries to the extremities, where we get claudication, cramping with exercise because of lack of nourishment, because of hardening of the arteries. So what can we do about that? It's obvious that hardening of the arteries, we call it atherosclerosis, is something we want to prevent. And it can be prevented. It can be prevented if we start at an early age with exercise, or any age with exercise, with proper nutrition, with proper sleep, and proper exercise. All of those will help get rid of hardening of the arteries. We need to know what our cholesterol level is. That's probably the most important thing. If we have a good cholesterol, that's what really swims around in the bloodstream like a garbage truck and takes away the plaques of cholesterol. Versus the LDL, the lousy cholesterol, that's what deposits in the blood vessels that make the blood vessels hard and give us hardening of the arteries. So there are wonderful medications that we can do to cut down on our cholesterol. We want to raise the good and get rid of the bad. The statin drugs do an excellent job of getting rid of the bad, while exercise helps get the good up. So know what your cholesterol levels are. If your cholesterol levels are abnormal, then know that you need to be doing everything you can, working out a program with your doctor to get your cholesterol better so that hardening of the arteries won't occur, or it can improve. Now, question number 2 from you, the viewer. Dr. Bob, I have pain in my right shoulder. What do I need to do about it? Well, let's talk about the shoulder. The shoulder has more motion than any other joint that we have in the body. The arm, the humerus, has a ball and socket joint into the shoulder. There are 4 muscles that keep the arm bone into the shoulder. They're called rotator cuff muscles. So we've got muscles and tendons that keep the arm into the shoulder. If something happens to those muscles, if there's a tear of the muscle or the tendon that goes from the muscle into the bone right there, if there is a problem with either one of those, then we get pain lifting. Maybe we can't comb our hair. Maybe we can't pull. It hurts at nighttime. People have a difficult time sleeping because they've got pain in their shoulder and they can't get in a proper position. If that happens and doesn't go away with rest, heat, and anti-inflammatory medications, it's time to see the doctor. The doctor will get x-rays. He'll find if there is a complete tear or a partial tear. He'll find out if maybe a cortisone injection will help. He'll find out maybe if physical therapy will help, or he'll find out if surgery is needed for rotator cuff. It's a real problem that's very, very common. Over 2 million people in the United States will have rotator cuff problems. It usually is more prevalent as we get older because the muscles become a little bit more dried up. The tendons aren't as good as we get older as they are at an earlier age. Shoulder pain doesn't go away, have to see your doctor. It's all the time that we have for this show. Hope you've enjoyed it as much as I have. Remember how important exercise is to your life. Exercise will help reduce stress. It will lower your blood pressure. It will raise the HDL, the good cholesterol. It will make you feel better. It will make you have a runner's high. That's where people that exercise regular feel better. Get 8 hours of sleep. There's nothing more important than 7.5 to 8 hours of sleep. It'll make you feel better. You'll be happier. You'll be less irritable. People around you will be happier. It's nothing more precious than a good night's sleep, 7.5 hours. If you're not sleeping well, talk to your doctor. You need to know how to go to sleep. Maybe it's medicines, maybe it's a painful shoulder that's keeping you from sleeping well. But if you're not sleeping well, you need to work that out with your doctor. We need to be sure that we prepare ourselves for sleep, that we slow down, that we get covers that are nice, that everything's dark, that there's no noise, and we drift away into sleep. Also, what do we eat? That tells us how our body's going to be. So we want more fruits and more vegetables. Why is that? Because we'll get less hardening of the arteries. We'll do better. Our nutrition will be better. So start the day off with fruit and fiber and make each meal later on a little bit less. And most of all, in the Dr. Bob Show, what is it we like? It's laughter in your life. The more you laugh, the healthier you're going to be. So find that person, tell funny stories, and stay healthy.